Well, this has been recorded on Monday, and I always say that with David Ashford because things do change quite fast, Minister Health and Social Care. I think we should really start with the vaccine, because in the UK we're seeing all these stories now that showing it being delivered. You told us we're on exactly the same system here, so you're going to tell me deliveries are here or ready for putting out tomorrow onwards?
So deliveries are not here yet, but they will be here within the next week or so.
So why are we behind?
And then we'll be able, because we have to have it transported from the UK. The UK has to get the stock in, which is what you're actually seeing. You're seeing the stock coming in from Belgium.
Yeah.
They then need to transport it to us, and then they need to account for that particular vaccine because, of course, it's done on a per head population. So they need to account for it as it comes through the UK.
So no conspiracy things on this, that we will get it?
No, we will get it. We will get our share, as we have said. In the initial batches, there'll be a couple of thousand for us to be able to utilise.
I saw the government page about how it's to be distributed. But it is the same as the UK, isn't it? You've got exactly the same.
It is. There is a couple of slight differences, but that's to do with the way the island's set up rather than anything else.
So the people in nursing homes and those carers?
Yes.
And then the frontline NHS?
Yes, and also then through the age ranges, starting with those over 85 and working our way down.
So let's try and push you for a timetable for next week, because we're going to see these pictures, aren't we? Tomorrow there's going to be people getting it all, and we're going to be a week behind at least, or that's definitely...
No, it'll be we will get the supplies within the next week, and then we are geared up ready to go into the nursing homes.
And is it a specialist thing to get it here then? This minus 70, whatever it is.
Yeah, with the Pfizer vaccine, the issue is about temperature. So firstly, you cannot shake the vaccine in any way during transport. It has got to remain perfectly still. The vaccine cannot be shaken. They come in deep freeze containers because they've got to be kept at minus 70. So there's been special dry ice boxes designed by Pfizer to carry the vaccine. On arrival, they then can be defrosted, but they've all got to be defrosted together. You can't split a tray, which is 975 to a tray. Once they are defrosted, they can be stored in a normal fridge for up to 5 days. But once you take them out and mix them, you've got 6 hours to deploy the vaccine.
And those people will be told well in advance, you're on the list, do you want it? Because we keep hearing now there's about a third in the UK, I think, on the survey in The Guardian that won't take it.
Yeah. Which is disappointing to hear. I hope people will change their mind once they start seeing the rollout. Obviously, it's quite natural people will perhaps have concerns to begin with, but unfortunately there's a lot of fake news out there as well that needs to be combated.
Well, obviously the nursing homes will be easy because people are there and you'll be able to get all the data. And I'm still intrigued about exactly, because it was made clear, but you were having to do some corrections there on Thursday about exactly how people were being contacted. It wasn't completely... You were all singing off the same hymn sheet, but
I think we were singing off the same hymn sheets. I think there was a bit of misinterpretation of what was being said.
Okay.
So let's make it absolutely clear. So what will happen is people will be written to. So they will physically receive a letter.
Right.
They're saying it's your turn. You're in this categorisation for the vaccine. So we're hoping to give at least a couple of weeks' notice for people. Then they will be able to ring 111. They will be instructed on the letter to ring 111, and via that they will book the exact date.
So they'll have a code or something, will they, on that letter?
So they'll have the name and address of the individual. 111 will be expecting the call, and from that's when they will then book their initial date. And of course, if it's the Pfizer vaccine, there's another dose 21 days yet later, so the second dose will be booked in as well.
Right, so you ring up and you'll be told it'll be your normal GP. It won't be a mass thing up at the hospital.
No, it'll be 111.
You ring 111, but then you'll be referred from this letter you've already got. You'll be booked in, and where will you get your dose?
To the central
GP?
hub that we are setting up, that we'll be announcing later this week.
Oh, okay. So it won't be done by GPs.
So the GPs will assist with the rollout in the community.
But one big central hub.
But there'll be one big central hub, which Catherine referred to in Thursday's press conference, that we'll be announcing.
Nobles Hospital or TT Grandstand?
No, it's not going to be the hospitals.
TT Grandstand?
Well, let's not speculate. No, I'm not going to give you any sneak previews in advance. We will announce that later.
And people got to get themselves there, obviously.
And there will be transport available as well. We're looking at the logistics of providing transport to get people into and out of the hub.
So this letter will say, be there at 1:15. It means 1:15.
Not the letter, let's be clear.
No, 111 will give you that time.
Yeah, and that will be the time the people need to be there for their appointment.
And if you miss that, you're in trouble, basically. But
Yeah, because it is crucial that on timings, because this is one of the things we have to stress. stress that the second dose needs to be delivered 21 days later. So not 22 days, not 23
is that
days.
precise?
It needs to be delivered 21 days later. So it is important, and that people have understanding that when they do get booked in and they get booked in for their second dose, that is set in stone, that must be when they go back for the second dose.
How many per hour are you going to be able to do, or per person, shall we say, per hour? Is there a sort of number that you're working to? Is it maybe 10 minutes of booking or 5 minutes of booking, or what will it
So
be?
it'll be about 10 minutes of booking. So we should be able to push people through quite quickly, we hope.
And this may or may not give them a sore arm. As far as I can see, that's the only thing I've seen so far.
It's the same with most vaccines, as laid out by the Director of Public Health. Some people will get a sore arm. Some people may have a mild fever for a couple of days. Some people may feel like they've got a cold or something like that for a couple of days. It does affect people differently, but this has been well trialled, and there has only been minor symptoms that people have had after the vaccine.
And the TV system using big syringes and everything, I understand it's just a normal sized little thing. It's not one of these big...
Yes, no, we won't be going at anyone
No.
with a large syringe. It's a normal sized syringe that is used.
If people don't take up that offer, if they don't ring 111, you know they haven't done that because you have this computerized system. Do you then follow up again with people to double check they got the letter, or is there some reason that you haven't got back?
We will be looking at follow-ups, but obviously we do have to stress that vaccination isn't mandatory. Vaccination is down to the individual. So while we may follow up and actually contact the person to find out if they had received the letter, if they know that it's their turn, it's not to try and force them to have the vaccine. If people do not wish to have it, that is their personal choice.